Not all patients can afford or are good candidates for in vitro fertilization, and repairing the tubes could be a very important instrument for these patients. This nowadays can be done laparoscopically. We even do reversal of tubal ligation laparoscopically, which means that it's a quick outpatient procedure and the patient basically reestablishes fertility should they desire to have more children. Obviously, in vitro fertilization is always available for cases where tubal repair is not possible. This is definitely an option, especially for patients that have limited resources. Obviously, when resources are not unlimited and the patient desires only one additional pregnancy, in vitro fertilization will be the proper choice, since they will still maintain their excellent contraception and they'll have the child that they desire. On the other hand, when resources are limited and it's difficult to have multiple in vitro fertilization procedures to achieve a single baby, reversal of tubal ligation is a very viable and probably the best option available. In addition to that, there are patients that due to infections or scar tissue or endometriosis have tubal damage and cannot get pregnant because of that. So this will be another group of patients that could benefit from repair of the tubes rather than subjecting themselves to the lengthy hormonal treatment preceding in vitro fertilization and the risk of multiple birth with in vitro fertilization. So tubal repair should definitely be considered for all these patients. In addition to that, there are surgical treatment that can be used as adjuvant or additional treatment to in vitro fertilization, such as treating endometriosis. It is quite well established that patients that do have endometriosis would have success rate in various fertility treatment of only about 50% than they would have had they had their endometriosis treated before. So all these patients will definitely benefit from the treatment of endometriosis in preparation for in vitro fertilization. So I think that finding a clinic that feel comfortable with surgical approach to infertility in addition to in vitro fertilization could be very helpful and offer a wider variety of options to you as a patient.